I was one of those guys that was into the core activation.
I mean,
So I'm looking forward to hearing what you guys have to say about this.
is it the word core that's offensive, or is it the core activation?
I think it's activation.
It's core?
It's the false education
It's
behind
false.
He's so angry already.
trainer.
And we haven't
Misinformation.
even started
It's a
yet.
certain type of trainer that just uses that word constantly.
I use it.
PTs too.
I use
That's what we're
it.
talking about.
We're talking, okay, specifically PT. I gotta stay focused.
You
All
can
right.
say fitness too.
Really. All right, so this episode is PT trends we'd like to see go away in 2025. It's going to be
Spicy.
so spicy. I'm scared. Okay, so we're gonna go with 3 topics from least offensive to most offensive, and we're just gonna dive right in. First trend we do not want to see continue in 2025 is, Ryan, you go.
Core activation, or the use of core activation, more specifically to cure low back pain or help with low back pain. Yeah, I mean, it's like rampant in physical therapy, in fitness. Like everybody just thinks that, you know, if you have a back injury, you have a weak back, then you need to strengthen your core, right? But the research has shown that there's really no solid evidence that supports that strengthening your core and doing all these silly exercises actually helps at all with your back pain. And talking about more like recent research, like within the last few years, and they've been researching this for ever, I would say. And the sad thing is that it's still taught that way in schools, in PT schools specifically, because the education system is so far behind current literature and research that that's what students come out of school thinking, is that your 40-year-old guy needs to do all these exercises like dead bugs and bird dogs and all these other stuff, and then, you know, they go to tie their shoes and they throw their back out again when they weren't really educated on how to load the spine, how to deadlift, how to squat. So it's really just, I would say it's to the point like it's epidemic. Like I would say more often than not, you're gonna find a physical therapist, if you walk into any clinic in America, that if you tell them you have low back pain, they're gonna say, oh, well, it's probably because your core is weak.
Well, let me ask you: is there like a half truth about core activation? Is it fully false, or is there some truth in there where it's like you can use some of it but not throw the whole baby out with the bathwater type thing?
Good question. I would say it depends on the context of what you're talking about, right? If you're just talking about general low back pain, there has been no research that has shown that using core activation exercises helps improve a patient's pain scale, function, their strength, or anything like that, functional strength.
Yeah, I think it really comes down to the fact that I think physical therapists and physical therapy as a whole, like we try to oversimplify pain, right? So it could be like shoulder, neck, whatever, but back especially, PTs have a tendency, and clinicians, I think people who are very clinical minded, they want to find the cause. And so they're like, and it's usually a singular cause, but I think when you're talking about pain and stuff like back pain, it's complicated. It is very complicated. And so to be like, oh, you got back pain, all right, you're weak. Let's strengthen and activate and stabilize. It's just not like that. And so I think it's that. And then secondly, when you're talking about the education, he just mentioned something about PT school and something that's not taught in PT school, and that's an inherent problem. That's a problem that I think is that serves as a foundation for a lot of these issues that are present in physical therapy. Is that the education that's provided in grad school and physical therapy school is still centered on the economics, which means they're really trying to make sure that they have high graduation rates and high pass rates for the licensure exam for the state. And so and the licensure exam for the states are all outdated. And so because the curriculum is trying to support that, the curriculum is very outdated, decades outdated. But they don't want to change it because the state's not going to change it, which means the schools aren't going to change. That means the PTs that are graduating are still learning the same stuff from 20, 30 years ago that by and large, it's pretty irrelevant in my opinion. You know, some of the stuff that is being taught and that's heavily focused on in education for physical therapists, it's really not relevant, I think, for like evidence-based, like good practice. You know, like using your brain practice, not remembering parameters and, you know, rubbing gels and electrodes and scraping and cupping and all that stuff, right? Yeah.
Yeah, I mean, I think the state board exams, they don't get changed for like, it's something ridiculous like 4 to 7 years. So factor that into, then the schools have to teach, obviously, to the board. So they're also behind. Like, you know, they're testing questions and whatnot, but, you know, with the education system, it's just super slow to change and super behind, even though we'll have, you know, here and there, we'll have little tidbits of like, oh, here's the current research on like this topic, but it's not being asked in the board. You know, that's the biggest problem.
How much do you think social media plays into core activation for back pain? Because there are popular physical therapists on social media that kind of act as like the educators of these types of things. You have low back pain, then try these and it'll be like a carousel of exercises including like dead bug or whatever that you were saying. So how much do you think social media plays a part in kind of like perpetuating this idea?
I mean, I think it plays a huge part in it. And, you know, most of these guys are kind of just giving very blanket exercises that might help a few people here and there. Just general exercises that...
One size fits all.
Yeah, like very safe to kind of put out to the public. But, you know, they usually offer a disclaimer, like it's not for educational purposes, whatnot. You know, if you need help with pain, like make sure you seek out medical advice. So, you know, they're doing their due diligence to, you know, cover their own, you know what. But, yeah, I mean, it's very catchy. Like it's very social media. Like they're looking for views, they're looking for clicks, and it's something very easy to put out there to the public.
So if someone's suffering from low back pain, what would a nuanced, smart, you know, person trying to get better do?
Go to your doctor or go to a physical therapist. Like you can try to do stuff on your own, and you know we like to have our patients be independent with that. But you know, a lot of people come in with a lot of fear that they're going to make themselves worse. So I would say if you have nowhere to start, you have no idea what you're doing, it's better to get somebody who preferably knows what they're doing, and seek medical advice from somebody who's actually educated to do this.
Yeah, I mean, to kind of answer your question in a little different angle is like if you're speaking to a therapist for the first time and you've gone in there for low back pain, if they just start like massaging you or they just start suctioning you and whatever else and scraping you, then I would be very, very just cautious about that, because I think a good therapist will look at, hey, like what are you doing majority of the time during a given day, right? So it could be like sleep or it could be like work, right? So if you're a desk job person, right, are you sitting all day 8, 9, 10, 12 hours a day in front of a computer, right? Or if you're like sleeping, like that's one of the questions I always ask, and I try to really get into people is like, what position do you sleep in?
Right.
And they tell me they're like, you know, on their back twisted up or on their belly or what, and you know, they're a toss and turner. Then I really just try to get into that, because without making those changes, I don't care what you do. Like you're just not going to help them that much in the net. You know, you're not going to benefit them that much, and so.
I think we did a story on that, like, or we highlighted one of your patients. Was it Coco? She had some back pain, and then she said that you asked her how she slept, and you had to have her retrain her sleeping patterns.
Yeah,
Was that
I
it?
do. Like that is same thing with like people who are, you know, if they have foot, ankle, knee problems. First thing I look at is the type of sneakers they wear, or shoes they wear, and how they wear it. Sometimes, you know, they don't. Not only do they wear the wrong shoe wear, but they
Wrong size.
Yeah, wrong size. They don't tie their shoelaces ever. You know, that kind of stuff. And so, I think you just like, if you're missing the obvious and you're not missing, you know, you just focus on the symptoms, then I would say that you have to question that clinician a little bit. Yeah.
Yeah, I think another thing that really kind of irks me too, especially talking about like the core activation for back pain, is making such a big emphasis on core strengthening and also like bracing. Like a lot of that emphasis is put from the schools of like you should be bracing anytime you like lift something up, or anytime you like bend down and tie your shoes. But the spine is supposed to be mobile. Like you're supposed to be able to bend, extend, twist, move a bunch of different directions. And if you're telling somebody to always keep a rigid core and basically flex their abs the whole time, then they're going to get into even more issues down the road, because they're never going to learn how to bend correctly, or not correctly, but how to bend again, how they used to, how to, be able to twist. So they're never really going into those range of motions anymore, and they just end up pulling their back again. Like, granted, if you're lifting, right, if you're lifting super heavy weight in the gym, or you're lifting something really heavy, like if you're helping a friend move, yeah, you should be bracing to increase that intra-abdominal pressure,
right.
To protect the spine. But if you're just doing like day-to-day stuff, like picking, your shoe off the ground, or tying your shoes, or just bending to pick something, you should not be completely bracing and trying to keep everything nice and stiff.
I have so much that I want to say.
Go for it. Rip it.
But you could edit it out. But there's one story that I actually want to share. Is that this was, I don't know how many years ago. This was a while ago, and I'll try to make it really quick. Is that a person came in, a lot of back pain. He said he's had it for like 20 years, and I don't remember if it was a physical therapist or Chiro, but they had told him to roll up a towel and sleep on it, on his back, with it under his lumbar spine.
Right.
And so he diligently did that for, I think he did it for like 20 years. Like, he never not did that. And so when I saw him, I was like, the guy literally, like, he's just, he couldn't even bend his back. And so the first thing I told him, I said, can you, as of today, get it out? Do not do it. And he was like fearful. He was like, that became his little blanket for some. And I said, remove it and just sleep without it. I got a call the next day. He said, no more back pain.
It's hilarious.
I never saw him again. It was the only time I saw him.
It's so bad.
And so 20 years he had slept with the rolled up towel
Right.
under his back, because this whole like general belief is that you got to create lordosis, which is a curve in the back. That there's this ideal curvature that everyone should have, but it's just not the case. We're all very individual. We're very almost like customized. Like, we have to be customized as far as treatments go. And so I just wanted to share that story. But there's so many other things, like the whole strength thing. Where you can just look at this in a real life situation where, like, look at the people that you know, right? And the people that have back pain and people who don't have back pain, right? And some of the people that have back pain are very fit, strong, powerlifters, bodybuilders, whatever, right? They have back pain. Some of them have more back pain than those people who may not even do much as far as exercise goes, right? And so, and everybody knows this. Like, everybody knows people that have back pain, that they look ideal as far as fitness and physique or what, right? And then you have others that don't have back pain, and they're all like this, and thin, and they don't do much, right? So what I think you have to understand is that when you talk about symptoms, pain, or what, it is something that is intangible. Our brain creates those sensations. There's nothing physical about pain, and so it's something that you just have to know that it's not so simple. It's not so like, oh, it's the L2, L4, with disc, or L2, L3 disc, or it's that facet joint right there. I just find that that's kind of a silly way of looking at any situation. But we do it as clinicians, and as clinicians as a whole, we're obsessed with finding the diagnosis. We're obsessed with finding the cause. But sometimes it's just not. Most of the time, it's just not that simple or singular.
Right. It sounds like a little bit more to do with mobility. Like, instead of so much bracing, there's more to the puzzle than just like stiffening the core or activating the core. Is that it? No?
In terms of like
I
getting
don't know,
somebody
just
out of
like,
pain?
or like, when you were saying how like the spine is fluid and you should be able to move in multiple planes and directions and things like that, maybe like someone might not be.
I'm in disagreement with a lot of that stuff.
Oh,
I think in
okay.
the fitness industry, like, there's just obsessed with mobility and flexibility. And I think that it's just not, again, that simple.
Right.
And I think you could potentially incur more injuries in the process too. Because there's a lot of stiff people with no problems.
Right.
There's a lot of very flexible people with tons of problems.
That's true too. I've seen that also.
I have one question.
Shoot.
What would you guys say to just a regular layman who doesn't really know all the things that you guys know, and they have back pain, and they've been maybe manipulated online and watching social media, or maybe not manipulated, but just falsely educated? What would you say to them if they have back pain and they're looking for help? Just to wrap everything up, what would you say? First step, second step, third step.
I mean, it would depend on the person's issues and what they've been told in the past. Like, they might have been told a lot of good things, and they might have seen a lot of bad things. And I mean, I would say for the general public, it's kind of tough to differentiate between a clinician who is really giving you like misinformation versus a clinician who's giving you really good information, right? Because we all kind of have the same degree, the certifications, the doctorate, whatever. But yeah, I would say if you've been going to like a provider, a healthcare provider, for the same issue for years and years, and it really hasn't changed or gotten any better, or maybe even gotten worse, you got to go somewhere else. You got to go somewhere else.
I think the one big thing I would tell those patients is like, are they educating you? Are they educating you about your issue and then what you can do yourself to prevent or hopefully improve, right, your status? And if it's not that, and they're only doing things to you, whether it be just touching you or rubbing things on you or doing whatever, using tools on you, then I really question that, because I don't know if that's healthcare. I think that's a good business model, but I don't think that's a good healthcare model. That you create a lot of dependency, and I say that a lot. Is that I think healthcare is obsessed with creating dependency because it's very economic. It's economic driven. And so
You're jumping ahead a little bit.
am I?
Yeah, that's the most offensive PT trend.
Oh,
Should we just go to the second one, which is I didn't even know this was a thing. A Chiro MD owned PT clinics versus PT owned clinics. That is on our PT trends that we don't want to see in 2025. I didn't even know that was a thing. So if you could elaborate on that.
Yeah, so there obviously are different types of physical therapy clinics. Somewhere like Maven, where it's owned by a physical therapist, privately owned. You have your chiropractor-owned clinic. Usually it's a multidisciplinary, so that you have chiropractic, PT, you might have OT in there, acupuncture, massage. So it's kind of like a one-stop shop, right?
I see.
And then you have your medical doctor-owned, so it's owned by a medical practice. And same thing, usually it's going to be multidisciplinary. You're going to have obviously your medical services from the doctor, PT, and then maybe a couple other things in there. So that's the biggest difference, is how it's owned. And then that kind of trickles down into the actual business practices of those different clinics. You want to elaborate a little bit on that?
yeah. I think it's just regardless of, let's say, ownership, right? I think what you have to kind of think about is like, who is most or more prone to violate ethics and legalities as they practice. And when you're talking about a physical therapy clinic, right? A physical therapist practices physical therapy. Chiropractor does not. MD does not, right? At least maybe physiatrist is legally allowed. In Chiro, I believe it's it's illegal for them to practice physical therapy in all states or most states.
That I don't know. I would assume it's most states. If not
This is
all.
like my legal source right here. But yeah, if you think about it, like they're not physical therapists, and so when they own it, I think that again, it could be very circumstantial, but I think they're more prone to violate ethics and legal rules, and I think economics could be the more driving force behind everything, and I think that's an issue in healthcare in general. But that's another podcast.
Yeah, I mean, think of it from the provider's standpoint, right? As the owner, you have somebody come in with a certain issue. They're probably going to be there for a while, whether it's from surgery or just kind of chronic pain. Wouldn't it make more sense, economic-wise, to not only have them do PT, but hey, we also have
I see.
chiropractic care. Oh, we also have acupuncture. We also have
Massage
massage.
therapist. Yeah.
Cupping.
Like we have all these providers here that are want to get you better.
Cryotherapy.
Yeah,
they
they
got
just
everything.
have all
What
this
is
stuff.
that? That's the cold stuff, right?
Yeah.
Okay.
But it's billed as like convenience for the patient, as a one-stop shop. You get
and,
access to all these
where
disciplines.
it gets really really bad is when they start kind of almost doing these like monthly memberships, right? Or these plans where you're allowed X amount of sessions for chiro and X amount of sessions for massage, and it's basically just kind of turns into like a spa, right? They're not really treating your issues anymore. They're just making you comfortable for the time that you're there.
Do we have those around here?
We have those around.
Oh, I didn't even know.
He's like, okay.
Yeah.
Well, let me go.
Yeah, my wife used to work for one. Yeah.
Oh.
Yeah.
Oh, it's like a
Yeah,
monthly
so, I mean,
membership to healthcare.
It's not. It looks like a
Okay,
membership,
I
right?
see.
You pay thousands of dollars and you have, X amount of benefits that you can use, and a lot of people just can't afford that.
Yeah.
And at the end of the day, it's probably not helping them either.
Right.
And I think if it was driven by the fact that they wanted to help people, like truly help people, was one thing. But no, I question that 100%. I think that's just purely driven for profit. That you can make more money that way. And so I think healthcare and education cannot be driven by economics. It has to be driven by your intent to help people. And so I think if those two already have sold out. So this is why we have these issues currently.
Yeah, but also on the flip side of it, you have a lot of PTs that are kind of getting into that realm as well, who are just kind of offering all these extra services.
Oh yeah.
To just kind of inflate their bank account a little bit, whether it's helping or not.
Cash based. Yeah. Fully cash. One-on-one they call it.
Can you give any examples of these extra services?
Yeah, I mean, we kind of touched on it a little bit, like the the cupping, the cryotherapy, the red light therapy, the compression sleeves, and most insurances probably aren't going to cover that stuff. So the patient's paying out of pocket. They're probably paying per session, right? And all those things feel great when you're getting them done to you, but it's not actually doing anything to solve whatever the root cause of your issue is.
Or from a long-term relief standpoint.
Yeah.
Does placebo play a role in any of those modalities?
Oh yeah.
Huge.
Yeah?
It's,
What
it's,
role does
it's
it
the
play?
main. Yeah, it's the main thing.
It's the main, okay.
Placebo is a hell of a drug.
Because again, pain is intangible, so it could be very easily manipulated.
Right.
Easily.
Yeah.
Wow.
For good or for worse.
What about electrical stimulation? Is that one of the things that is used often in a PT office?
Oh yeah. Yeah, you'll see stim machines, ultrasound machines, basically at every clinic. And some stim machines can be used, for helping activate muscles for somebody who is post-surgical. So it's good for like the very initial stages. After that, it's like just pain management. Like you can get a TENS machine off Amazon,
Right.
and they're like $20, right?
You
But
get
again, it's just kind of
Theragun, red light
it's putting a
panels.
Band-Aid on the issue.
Okay.
I see.
It's temporary pain management, like most modalities.
Okay.
Yeah, all those things the consumer can do on their own.
Yeah,
And so why would you go to a PT for that?
Right.
because we're educated.
And you could also bill, insurance, and you can make a quick buck for that. It's brainless. It's just whatever. Stick the little stickies on, and set it to a parameter, and I feel the patients like it. It's a little buzzy, and it's perfect. I think we're smart enough as a profession to know what modalities are perfect to just appease the patient. Yeah.
Right.
So, not being we don't do those things, or Maven doesn't do those things, those modalities. This is going to lead into probably our third most offensive, right? Is that third most offensive trend that we don't want to see in 2025? So we said manual therapy overuse. So first, maybe describe what manual therapy is for the layperson.
I love the fact you said overuse, because it's not, and we want to clarify. Like there really is a time and a place for certain things. We listed a lot of different things, and some of those things I think are completely useless. And it like grosses me out just seeing it, and physical therapists and doctors of physical therapy, doing those things. But I think there are things like certain manual therapy techniques that there's a time and a place, and it could be beneficial to the patient. But I think the overuse and overutilization is highly manipulative, and it's just no good. Yeah, it's not good.
Yeah, so answer your question, manual therapy, so that's just a blanket term for tissue manipulation. That could be soft tissue massage, it could be joint mobilizations, even just straight up stretching somebody. Could also be used with modalities, so like cupping, needling, scraping, anything to manipulate with somebody's hands in order to get a desired effect.
Yeah, like I compare it to, how doctors could prescribe meds, right? Or they could perform surgery, or, it's something that, and when you're talking about overutilization, I think for a physician, it would be mainly meds and surgery, right? For physical therapists, I think it's in our hands and our tools.
Right.
And so when you overutilize and when you use those as pretty much weapons of manipulation, I think it's just horrible. Like I think that it's like no different than we're supposed to be like, and we usually a lot of times knock on like meds and drugs and stuff like that, and people overusing that. But here we are, we're doing pretty much the same thing by we call it manual therapy, but to a patient it's just massage. They don't know the difference, and so you're basically providing massage and doing little buzzy things, and we know that patients will take to it. And it makes us feel very good about it, inflates our ego. People immediately give you some type of feedback that's usually positive. And at the end of the day, they come back, which is, I think, the biggest thing. And it's make more money that way. And so,
Yeah, I think that's the biggest issue with most clinics. I mean, you walk into 9 out of 10 clinics in your town, and I guarantee you every single patient is getting some form of manual therapy included in their session for maybe no reason at all, other than to just bring them back and make them feel good.
Right.
And it just creates that sense of like dependence. Like the patient thinks that they are getting better from what I'm doing with my hands versus what I can do for them in order to educate them and help actually relieve their symptoms more long term, right?
I have another story about that overutilization. And my first job, I won't name it, but currently it is now bought out and owned by Professional Physical Therapy, right? And this clinic that used to be privately owned, that sold out, they used to tell me that I had to bill 6 units, and I had to touch the patient, and I had to do ultrasound. This was back in the day when ultrasound was used a lot.
Still used a lot.
Yeah, and I used to get pulled into the office because I wouldn't do it, and I get in trouble. For my 90-day review, I got in so much trouble. I'm not the type to take that stuff, so I was fuming inside too, and I lasted 90 days in my first job, because I couldn't do that. Like there's no way. And here I am. I actually thought, and I thought like I thought a doctor of physical therapy. Like I don't just pretend to wear the white coat thing, and no, I legit approached my job as if I was peers with other doctors. And so I had that mentality. And when these my employers were telling me that I had to bill a certain number of units, and I had to do certain type of treatments, and I had to start everyone with 1 pound ankle weights, they had sheets that had all the protocols set. And no matter, even if the patient walked in without any limp through the door, I had to put a 1 pound ankle weight on them, because the insurance wants to see progress. If you don't see progress, they want to not pay. So you start them elementary, basically forge the notes to reflect that the patient's progressing. Right. You start them really low, you could keep going, and you could see them and basically exhaust their benefits. And so I think I lost 10 pounds in 90 days just from stress, and then just being pulled into that office, I think 3 times, and then final 90-day review. It was almost like a mutual, we're firing you, and then I was like, I'm quitting.
You've talked about this before with us, about the requirement to touch patients. Can you elaborate for the podcast for people, why they required you to touch them, and what the psychology behind that was?
Yeah, I mean, I don't think it's a complicated science or psychology, because when you touch somebody, it's highly manipulative. It is. No matter, even it could be therapeutic, but it is I know this because in my first like 10 years of being a physical therapist, because like it was much more of a manual world and profession back then. I mean, it's come back again, full circle. But it's like I remember like when I would touch a patient, it was almost like automatic. They were completely hooked on my hands. That's all they wanted. They didn't want to move, and it was almost it was literally a drug. Like my hands were a drug to that patient, and I witnessed it, I experienced it, and then I didn't like it. I didn't like it at all, and then it was horrible for my hands. I still my thumb knuckles from all the digging I had to do. It's still I got arthritis in my thumbs.
So is that why you didn't like putting your
I
hands
hated it because of the fact that I knew deep down that wasn't helping them in the long term.
Right.
I was bruising the heck out of them. Of course, if you dig in somebody, right?
They feel like something's going
Yeah,
on.
because you just inflicted actually a more painful stimulus, right?
Yeah.
And so now their pain doesn't feel like as much. But you wait another hour or two or a day, it's back again, you know? And so, in most cases. And so,
Yeah, it's just that it just gets to be this constant cycle of patient feels good, they go home, they feel the same or worse, depending on how sore they are. Come back, massage, feel good, go back, same. So if you're really just basing all your treatment off of manual therapy modalities, you're just gonna constantly be in that cycle of just not really getting them anywhere,
Right.
other than back in the door.
So like a drug, literally.
Yeah,
Like
I mean,
you're
they're
constantly
hooked.
searching for that next,
Yeah.
getting back to,
it's the perfect combo. Like they get that fast, maybe even temporary relief, and then you get your ego fully fed. Like you feel good because you just did that, and it's hard to let go of it. Like you yourself almost get addicted to it because you love the ego boost and the pride and everything in it. Yeah, because they really talk highly of you.
Yeah, and I think one of the things that we really try to do here is, when we do manual therapy on patients, is that we make sure we break it down and educate them on, why we're doing this, why it's going to be a temporary thing, and to make sure that they are on the same page as us and educate them that this is a temporary thing to help in getting you moving and being able to do more in therapy, right? I think it has to be used in conjunction. You can't just have somebody lie on the table and massage and stretch them out, whatever, and just kind of have, walk out the door, right? Because you're doing disservice to that patient because they're just going to keep coming back and not getting any better. So we make sure that we educate them and they are aware that, the manual therapy thing, it's temporary. We're going to be doing it until you start to get a little bit better, a little bit more movement, and then we're done with that, right?
Yeah. When I hear patients come in and they're like, I went to another physical therapist, or I went to a Chiro, and I've been going, and they're like, and how long you been going for this back pain? And when I hear like 6 months, 8 months, 2 years, and I was like, are you significantly better? And many of them are like, no, it just comes and goes, and I'm like, so you've been going to.
I feel good, I'm there, and then a couple days later, I just kind of feel the same again.
Yeah. So, I mean, my given rule with all my patients, and this is something I tell every patient, I go, within 6 to 8 sessions, if you don't have noticeable improvement that's lasting from what I do, you got to communicate that, and we have to either modify the program, or there's a chance I may not be able to help you.
I see.
Yeah. And I say that to almost every patient that walks in.
You don't want them to you don't want to create a dependence on you for their health and their fitness.
I feel like that's what Maven reflects. Maven is all about, it was built on this, is that we are all about trying to create independence for the patient, not dependency on this. And that's why I think the only way you do that is through, really the main thing is exercise and movement, because I mean everything else is dependency. If we do a lot of manual therapy, then they become fully dependent on our hands. If you use modalities, then they become fully dependent on something that's external again, right? And if you're not really educating them, then they're clueless. Yeah. And so,
Do either of you have experience at a PT clinic like that?
Of course.
My
Of course.
Yeah.
it's like I just go to those.
No, I
I just finished my session before this.
No, before Maven.
3 memberships.
I mean, I think I'm probably the average PT patient, consumer, whatever. I got injured I think my knee was bothering me when I first got into fitness, and I got stim, I got ice, I got ankle weights,
Yeah.
I got massage.
Oh yeah.
I had
got
some
the
low
works.
back pain too, but that one was actually really helpful because I think my pelvis was out of alignment. So I think.
Oh, don't
Oh no! It helped me though.
Next episode.
I thought it helped me.
When they
but,
start doing this, I'm like,
yeah.
no,
But you
don't do
know,
that.
I think I kind
Feel
of
that.
do feel like oftentimes PT patients don't want to get stuck like in like this endless cycle of they just want to get back to what they want to do. They
Yeah.
want to get better. Yeah. So
But then why do people go to chiropractors for 20 years?
yeah, that's true. I
Yeah.
don't know.
Because
My
it
friend
feels
right
good.
now.
Because it feels good.
Yeah. My friend right
Yeah.
now, he has lower back pain. He keeps going to the chiropractor. I'm like, bro, you have to come to PT. Come to Maven. We'll actually get you better and then change the lifestyle, turn it into like more of an exercise, fitness lifestyle, and you'll be fine.
But you know, like,
It's very hard to break
Yeah,
that
I think it's
cycle.
hard.
It is.
It's very hard. I know
I
people
would
very
say-
close to me that have been going to chiropractor for like 10, 15 years for the same issue, and it's
and you love it when they talk about it, right?
yeah, I love it.
I would say though that at this PT clinic that I went to where they had me do like the whole thing, the stim, the ice or whatever, there was a student who was more into like exercise movement and who understood like I wanted to get back to that, and so he used exercise. So I feel like there's a lot of hope.
How many years ago was
Changing.
I was way before, like
Might have been
probably
Ryan.
like no, it wasn't Ryan. I think it was a long time ago. It was probably after Erin was born, so she's 10 years old now. But yeah, like in premise, and then that guy understood that I felt like he was kind of like this new wave of PTs, so that gave me hope. And he told me that he wanted to create a PT clinic similar to this.
Yeah.
Maybe that was me.
It wasn't you.
Yeah, I mean, don't get me wrong. There's been, with, I think, social media, there's been a bigger influx of PTs that are a lot more movement-based. But, they still have their toys and, their modalities. But I don't know if we'll ever truly get away from that because, again, it's a good marketing tool. It's really good for getting patients back in the door, and it feels good.
I have a question about that because it seems like what you said, there's like a new wave of or a new generation of PTs that are, changing up the way things are done. So it's more movement based, like you said. So what advice would you give to someone who's been doing or relying on these modalities? What advice would you give to them to sort of transition into like more evidence-based and science-based?
But just before you answer that, for me is the whole new generation thing. I don't think it's a new generation.
Okay.
I think that there is a handful of outliers that are exceptions to still, like in my opinion, as physical therapists, like sheep mentality. Like they just do whatever they were taught in school or their CI at some point, whatever. They don't know how to think. They don't know how to think outside of that old raggedy box that they've been thinking inside of, and I think there are a few outliers out there that actually really are able to practice the way that I think you should be practicing. But yeah, I think most of the patients out there, even the new generation, no, I think they're the same. They're just younger. Yeah.
Okay.
Anyway.
That's right. What was your question?
It was, like what
So sad.
advice would you give to the older physical therapists that maybe don't know much about the like movement-based PT and stuff like that?
Oh, I mean, if you've been practicing for a while and you've been doing that for 15, 20, 25 years, I mean, they're going to be stuck in their ways. There's really no, I guess, changing people because, if you've been doing something and you've been getting by,
Right.
why change it,
Right.
right? Unless you really care about somebody and you care about, I guess, being the best clinician that you can, which, if that's you, then that's great. But most PTs, they're just going to do status quo. They're going to do what they're asked, and that's it. It's very easy. It's very easy to just be complacent. I would say if you're a patient who's been looking for a clinic like that, if you see on their website any mention of like modalities as like, stuff that they use for treatment, probably best to find another clinic. Because if they're marketing that for PT and use as treatment, it's probably more of a modality and manual-based clinic. And again, there's time and place for everything, but if that's basically what you're getting as treatment, then you're just being conned out of it.
Yeah, it's really disheartening, when I think about our profession and the direction that it's been going, the type of clinicians that I've seen, the new ones, and then also the type of clinics. I think that, the chains are just rampant. Chiro owned places and MD owned, like that's, they're way outnumbering the physical therapist owned facilities. And physical therapy owned clinics are decreasing by the year significantly. And so it's definitely disheartening, but I think we're going to still stick to it, and we're going to try to practice the way that I think really will benefit the patient in the long term. It may not be popular on social media, or it might not be popular sometimes with the masses, but I think we believe that it does help the patient most in the long term. So we're going to stick to the guns.
We ain't selling out.
No selling.
Yeah.
Done.